All right, welcome to our explainer. Today, we are jumping right into a super important topic, especially for your IBCLC exam prep. We're going to break down the Academy of Breastfeeding Medicine's protocol for supporting breastfeeding infants who have insulin-dependent diabetes. My goal is to give you the most critical, high-yield points you absolutely need to know.
So let's start right here. This quote is really our North Star, the whole foundation of what we do. Breastfeeding is the biological default, right? But, when an infant gets a diabetes diagnosis, managing their blood sugar can feel so impossible. It often leads families to believe they have to stop breastfeeding, and that's exactly what this protocol is designed to help us prevent.
Okay, so here's our game plan for this review. First, we'll talk about why this is such a big deal. Then we'll cover the real basics of insulin, and after that, we'll tackle the trickiest part, counting carbs in breast milk. We'll look at some practical ways to dose insulin and, finally, wrap up with what is truly our most important job, supporting the family.
So why is this so tough? Well, the absolute main goal of managing diabetes is to keep that blood glucose in a really specific target range. But with a baby, you're dealing with feeding patterns that are all over the place, totally unpredictable. And that makes getting stable blood sugar levels incredibly challenging, no matter if the baby is breastfed or formula fed.
So to handle all that unpredictability, insulin therapy is set up to basically mimic what a healthy pancreas does naturally. And it does this by using two totally different kinds of insulin to cover the body's needs 24/7.
And here's the key breakdown you need to know. About half to two-thirds of a baby's total daily insulin is what's called basal insulin. Think of it like a slow, steady background drip that's always there. The rest of it is the bolus dose, and that's the fast-acting shot given for feeds and to bring down any high blood sugar readings. Which brings us to what the protocol itself calls the single most challenging part of this whole thing for families and clinicians, trying to figure out just how much carbohydrate the baby is getting from breast milk. You got to know that to calculate the bolus dose.
So this leads us to probably the single most important number you need to memorize from this entire protocol for your exam. When they ask you to calculate the carbs in breast milk, what number do you use?
Here it is. Burn this into your brain. 7 grams of carbs per 100 milliliters of milk. This number comes from an average of 70 grams of lactose per liter, and it's a really stable, reliable figure for most infants who are diagnosed after that initial newborn phase. This is your go-to number.
Okay, so how do we actually use that number? Well, the protocol gives us two main ways to go about it. The first is to use population averages. So you take the average daily milk intake for a baby of a certain age and divide it by how many times they feed. Or, for way more precision, you can do pre- and post-feed weights with a scale, where every gram of weight the baby gains equals 1 milliliter of milk they've taken in.
But what about those babies who are grazers? The ones who eat small amounts really frequently. Trying to count carbs for every single one of those little feeds would be a nightmare. So, the protocol gives us this super practical alternative. Just check the baby's blood sugar every 3 hours and only give a bolus of insulin to correct for high numbers. You're not even trying to cover the carbs from the feed itself.
So, once you've got an estimate for the carbs, the next challenge is getting that tiny, precise dose of insulin into the baby. And the kind of technology the family uses here can make a massive difference.
The difference between shots and pumps is absolutely crucial for infants. With injections, the very smallest dose you can usually give is a half unit. For a tiny little baby, that can be way too much insulin. An insulin pump, on the other hand, can deliver insulin in tenths or even hundredths of a unit. That level of precision is just so much better for an infant, and it's been shown to improve everything from metabolic control to their quality of life.
And this brings us to our last section, and honestly, it might be the most important one. Because beyond all the math and the scales and the technology, there is a family that is under an incredible amount of stress. Our role as lactation consultants goes way, way beyond the numbers.
This quote from the protocol, wow, it's just so powerful. Parents are already carrying this huge weight of guilt and anxiety. And if they get even a hint of frustration from us about how hard it is to breastfeed and count carbs, it just piles onto their burden. It makes them feel like breastfeeding is the problem. Our job is to be their biggest advocate and reassure them that they are doing the absolute best thing for their child.
So let's wrap this all up with a quick, high-yield summary for your exam. Number 1, always, always promote breastfeeding. 2, use that magic number, 7 grams per 100 milliliters for carbs. 3, know the different ways to estimate intake, including that workaround for the grazers. 4, understand why insulin pumps are so beneficial. And finally, Above all else, remember to tailor the entire plan to support the needs of that unique breastfeeding dyad.
And this final question is exactly where the protocol leaves us. Looking ahead, as technology like continuous glucose monitors and smart insulin pumps get better and more common, the dream is to use that tech to make breastfeeding with diabetes feel seamless. The question for all of us as advocates is, how do we push for the research and the tools that will finally make breastfeeding the easiest, most supported choice a family can possibly make?